Do you know what's in your mouth? Chances are you don't, and what you don't know could be harmful to your health.
Tonight, a Taking Action investigation reveals a lot of crowns, bridges, and other dental restorations are made in China. WHNT News 19's Clarissa Stevens joins us now.
You got my attention. I'm guessing a lot of patients don't even know about this.
I mean, that's right. Most patients don't think twice about where their restorations are made. But the simple fact is a lot of dentists purchase dental work from overseas labs to save money. And as you'll see for yourself in tonight's special report, Dental Dangers, cutting costs could be putting you at risk.
The health hazards of products made in China have been big news lately.
These toys are made in China where contractors and subcontractors manufacture them.
Recalls on toys because they contain lead.
Media, dozens of babies have developed kidney stones in recent days.
Milk products tainted with melamine.
Some charms, bracelets, and pendants sold in the U.S. but manufactured in China.
And toxic cadmium concerns in jewelry. So, should we be concerned if the molded metal and porcelain products that give us our pearly whites were made there too?
Some of the products that are being made proven to have lead in them. And lead is not something that's healthy for the human body.
Dr. Denton Kimbrough, a Huntsville dentist of 31 years, says a crown is cemented into your mouth and essentially becomes a part of the body that lasts for years. Not made in the USA is a growing trend, often referred to as offshore dentistry. The work is being outsourced to countries like China, the Philippines, Malaysia, Korea, and Vietnam, just to name a few. And it's not just crowns, it's also bridges, partials, and other restorative work. And most patients don't even know what's going into their mouths.
I have some concerns that maybe they don't have enough information, that maybe patients are assuming that crown or that restoration is being made in the United States with quality materials.
Dr. Kimbrough says the overseas labs are unregulated.
It was a surprise to me.
Brenda Morris is glad Dr. Kimbrough volunteered the info to her, but she's astonished that full disclosure isn't required of dentists.
Although it didn't occur to me before, I would want to be informed of that, particularly in today's world where we have had things that have been recalled from other countries.
So why do dentists buy from overseas labs? The simple answer is it's cheaper. It's a way to cut costs and boost profits.
We make crowns and veneers, dentures.
Matt Winstead is the vice president of Oral Arts Dental Laboratories, a manufacturer of dental appliances in Huntsville since 1970.
She's contouring some of the anatomy into the tooth.
At Oral Arts, the base unit crown starts at $109. In China, to make that same crown, Winstead says a dentist could pay as little as $25. But at that price, Winstead says something else suffers, the quality.
You don't have any control over what's happening. You don't know what's happening.
Winstead says contaminated crowns can be an issue in foreign labs and patients would be totally clueless about it.
The labs are not telling the dentist what they're doing, and the dentists are not telling the patients what they're doing, and the whole thing is an attempt to save money.
Saving money, possibly at the expense of patients, and not telling you is not against the law, at least for now. Dr. Leo DeRozier, president of the Alabama Board of Dental Examiners, says that's likely to change in the near future.
We don't have any actual written laws governing this in the state of Alabama, but I do foresee these being placed into the Practice Act.
Right now, when a crown mold is sent to a laboratory, the Alabama Dental Practice Act requires dentists to write a prescription that includes, among other things, a specification of the type and quality of materials to be used. DeRozier believes this portion of the Dental Practice Act holds dentists accountable.
The patient is actually very well protected, even though there is not a law that demands disclosure to the patient. But even without this law, the patient can certainly request the information from the dentist, and I know the dentist would provide it to them.
I'm informing them.
Dr. Kimbrough only uses laboratories in the United States and makes sure his patients know it.
We make them with the best materials, FDA approved.
For Kimbrough, choosing between a higher profit and his patients is an easy choice.
I always treat my patients like I want to treat my family or treat myself. What would I want in my mouth?
So the message here is be proactive. You won't know if you don't ask. Here are some questions that you should ask your dentist. Do you make your own crowns and bridges or purchase them from a laboratory? Where is the lab located? Does the lab outsource crowns or bridges to a foreign country? And if so, can the lab provide written documentation that it uses FDA-approved materials? Now, while patients need to be on alert, DeRosier pointed out there have not been any cases of toxic crowns or heavy metal poisoning from crowns in Alabama.
Clarissa, let me ask you this. Should these dentists be asking their labs questions as well?
Yes, the American Dental Association says that dentists should be asking their labs if any part of their work is outsourced to a foreign country. And if so, they need to ask specifically what work is being done. And they should also ask for an FDA registration number.
Great information. Thanks, Clarissa.